Hello, friends. A very good morning to all of you out there, and a very, very warm welcome from the entire team of RFA Theaters. Your mentor this side. Thank you so much for joining in. Is my voice audible and clear to all of you out there? Hi, can you all hear me loud and clear? A very, very warm welcome with all this enthusiasm, with all this zeal and zest. We are going to begin a new journey, a new chapter. Mrcpi Osce, November 2026 preparation. I'm super proud of all of you who have been eager to start the preparation. I'm super proud of all those who actually want to start earlier so that the stress is less in the end. Nevertheless, there have been some unforeseen circumstances, and we do know that the previous exam was cancelled in Oman, and there have been a bulk. My own around 200 students are waiting, and I'm sure that you all are now ready for the November. Even then, your preparation wasn't slower. You were all set for May. So let me tell you and reassure that we never get our past input wasted. It's always piling up. It's always making our standard better. It is always making us stronger for the upcoming exam. Thank you so much for joining in once again. Hello, Seema. How are you, my dear? Hi, my dear Mahasin. Thank you very much, Nasreen. So good to see all of you here. And as I've mentioned, I'm proud of your efforts, just waiting for the piece all over and hoping that all the things that get back to normal and the exams are in time at its place so that you can do your visa, administrative work, and all these things that go well as expected. Thank you so much. All right. So when I get the question for all the newcomers, and this introduction later will be seen for all those who are appearing in September 2026. There are many who are actually taking the exam for the first time. So my expectation to all of you is that Shirin walaikum assalam rahmatullahi wa barakatuhu. My expectation from all of you is that do start in time. Reason for that is that whenever the preparation is taken in the last few weeks and months, number one, the exam stresses more. Number two, definitely Rumi, thank you very much. Definitely the exam pressure builds up and we are not at peace. We have the anxiety of failure. We have the anxiety of unknown before preparing an exam. So earlier, the better. I was talking to one of the students for MRCOG 3 from Egypt a little while earlier. She called me saying that, ma'am, this are the duty schedules going on, and she's appearing for November. I told her the same, that the earlier you build up your confidence. For example, if I'm a student, guys, I will be thinking that my exam is after 3 months rather than 6 months. Do you get what I mean? So if you always keep your threshold more towards preparing early and you have multiple revision times, you're definitely a stronger candidate as compared to those who are considering that, okay, last 2 months we're going to do everything. So from today, make up your mind that your exam is not in November, your exam is in September. Are you guys agreeing to this? Right? If you will have this mindset that your exam is in September, you would see that how stronger your preparation will be. You will get a speed as well. So if you make your schedule, make it in a way that September it's ending up, you have done everything, and then you have the revision time because that polishing, which would come in the end, that would be the one which would make you score not only passing 80% and above as your seniors in Mrcpi they have been receiving. Thank you so much. Uh, Wonderful results in the last exam in February. And to my surprise, so many students were. Thank you so much. This was to encourage you guys. This was to tell you guys that everybody has started this way. They all were anxious before appearing in exam as well, but such high scores and record-breaking scores were there, and this was only possible. Again, I would say this was only possible with your efforts along with our humble supervision there. So I just want Rumi, Shirin, Seema, that we work so hard in a sequence with the daily schedule that nothing is difficult. Everything is on our tips and we are able to handle the exam. As per the recent exam yesterday, which was day 2, and day before yesterday, which was day 1, a little shuffling has happened. It's not that there were absolutely new cases, but yes, a little question and answers have been changed. So the course is going to be all updated. I'm going to do all the regular sessions module wise. There have been wonderful feedbacks earlier as well. Regular is going to be in a way which would be according to the modules, like you will do early pregnancy with me, you're going to do antenatal care, maternal medicine with me. These modules will make your preparation very strong and your base is very strong to handle all the structured discussions and of course the simulated patient task as well. So we had a postponed exam of Mrcpi, which was this time. And now what we are concerned about is the next exam, which is going to be the November, right? And this exam in November would be in Ireland, but the international venue has not been revealed and has not been announced on the website. Hoping and praying that it all goes fine. Lots of students are asking, ma'am, shall we take Ireland? If you can travel to Ireland, and if it's not a difficulty, definitely that is a surety that you are appearing an exam if you get the seat, right? For the other venues, definitely depends upon how the circumstances are, how the situation is. Is the college able to conduct the exam or not? We cannot comment upon that at the moment. There's another question which I'm receiving, Rumita, is that the people who have been postponed from Oman exam, is it going to be an extra exam? So again, the college has not given any update on that. There is a chance that we might get an exam, but there is a chance that we might not have an extra exam. But not, so far, November is the only exam that's happening, and there's no exam that has been announced as an interval exam before November. So be ready for November. The timeline is going to be for the November. We are going to announce in the group the opening date for the registrations. It is going to be August, and then we do have September for the closing dates. And later, you will be expecting the results 4 weeks later. That is the November exam would be in December 2026. The results would be announced. Yes. With regards to the Osce, there are a few newcomers, and there will be people who are listening to the session just to know how many stations do we have. We have 7 circuit stations, and out of those 7 circuit stations, we have 6 single structure discussions, and we have 1 simulated patient task, and we have 1 rest station. So basically 7 practical station is there plus 1 rest station is there, and that is going to make your things smooth in terms of knowing that what section I have to prepare, what part I have to prepare, and it makes me prepare how much percentage of your curriculum to appear in exam. The long clinical case, that is the long case, is going to be 1. That's going to be either obstetrics or it's going to be gynecology. And expected cases are there, but I'll give you the list which you have to prepare. At the end of the day, the approach has to be very patient safe, and college is very supportive to make everybody pass unless you make big blunders, I always say. It is definitely an English exam. So you should be knowing about the circuit stations. You should be knowing about the long cases. You should know that every station in the circuit is going to be 10 minutes and 1 rest station is there. It will have your domains to be tested, your patient safety, your applied clinical knowledge, your communication with the patient and your simulated patient task and your information gathering. In long case, we do have the sections like history, examination, investigation, treatment, making a good differential, justifying that, then making a good diagnosis after investigation and managing that well. These all are the important components that you should be knowing about. So, of course, we have to prepare both the long cases. We have to prepare the obstetrics, we have to prepare the gynecology. 25 minutes, you have the long case. And in those 25 minutes, you have to make sure that you do your history examination, investigation, and treatment plan. And if examiner does ask some question, you're ready for that as well. I'm going to prepare you in a way that you're ready for your long case perfectly. You're knowing about that all the details are very clear to you. It has to be, unfortunately, all the sections passing of the loan case. We can't have a compensation of the loan case by any other loan case, unfortunately, because we don't have any other. May 2021, nothing much, but it's just that they have made certain sections. Sometimes they do give the labor ward prioritization. If they don't give the labor ward prioritization, they give the obstetric emergency. You should have a patient-safe approach in all the cases. If you're a safe doctor, nobody can fail you in exam. If your approach towards having a good history and examination and the diagnosis is correct, your clinical skills are apt, and you have been practicing, you have been working, and your reflexes are very strong, again, nobody can actually fail you in this exam. This exam is a very straightforward exam. I want you guys to start working on long case history from now. I want you to start working on the circuit module wise with the course schedule, which will be starting tomorrow from now, and start practicing. More speaking would be needed. Nobody comes to an exam with an aim to fail an exam, 100%. We all want to clear the exam. We all want to pass the exam. The problem is unstructured way. We are all busy. We have got families, we've got hospital chores, we have got the home domestic work. We've got lots of things to be done. The duties are tough. Kids, commitments, they keep on coming. Family commitments, they keep on coming. Then who is the successful student? The successful student is the one who starts in time, who reinforces properly, who does the work confidently, and then has a very good time for revision as well. I always say a student who is able to revise well is the one who is polishing the skills perfectly. Nobody wants to fail the exam, but there are few students in the last 15 or 20 days, they're not able to recall the information. Reason is lack of revision. Reason is lack of practice. Reason is not getting that confidence which should be in the Osce because it is a speaking exam. For the circuit, every single station in the regular and the fast track should be on your tips. Every single summary for 2024, 2025, 2026 being uploaded, that should be on your tips. Nothing would be outside this for your exam. The long cases should be on your tips with a very strong history, with a perfect examination skills with your hands, and investigation justification should be very clear to you. Why are you doing this investigation? What is the reason to have this investigation? Asking for investigation which is not needed makes you fail, and not doing an investigation which is needed also makes you fail. So please be ready for that. Understand from day one. And when the sessions will start, you will understand that how and where we need more attention, where we need more practice. The ebook is all updated, guys. We had new updates. Now, as I've mentioned, the topics are not new, but the questions are added in the last yesterday and day before yesterday. There had been new upcoming parts of the questions that we are updating, and the team has started already working on that. We need just 24 to 48 hours to update all the system, and all those who are in November 2026, you will get all the updated course along with the sessions, along with the daily schedule. And because the fast track would be including the recent 2 exams, which have been covered yesterday and day before yesterday. So the previous stations which we have to remove, we will be shifting that to the regular course. So regular course is starting now. The ones who want to be active, this is the link, please. The ones who are already there in the previous course and they want to attend for the daily schedule, please, you've got your links. Please get connected for the addendum link there. And we are going to start with an early pregnancy. the first session. I'm going to take that in the morning, guys. That makes Saturday. And rest of the sessions, we will discuss the timings. All the sessions are in front of you guys. I've given ample time in between. Your schedule is already there. You all should be knowing about that, what exactly you have to cover. I'm not going to show the whole schedule, but in the study group, you have the schedule. I'll just show you the last dates after the slide pausing. And here we go. So you see that I've shown you the May, and after that, it is going till July, and all the details have been given. When you will do one module, you will cover every single aspect of that module. That includes all the guidelines, that includes the SPTs, that includes the structured discussion, that includes the patient information leaflet that's needed. Everything would be there, right? Now, there has been a station day before yesterday, and it came as a structured discussion. I have that in the regular course. Hi, Jabin. How are you, my dear? I want to volunteer. Let's practice one station. It's a structured discussion, not an SPT, guys. Anyone who is ready to practice one station, which came day before yesterday, day 1 of May 2026. Who is going to practice? Let's do one station to see that how the structured discussion should be. Or any questions so far? Any questions about the preparation? Any questions? Thank you very much, Jabi. Any question regarding the preparation? Any question regarding the exam strategy? Any question which you guys need to know regarding your course curriculum? You all have got the daily schedule there. The feedbacks would be given every day. I want you to learn from the feedbacks. All right. Who's going to do the case? Anyone? Nasreen, I am so proud of you. Can I have your camera? Thank you so much, Nasreen. Enter into the cubicle. Time starts now.
Okay. Hello, I will start.
Start, please.
طيب. Hello, I'm Dr. Nisreen, one of exam candidate, and this is my sticker.
Thank you very much. Thank you, Nasreen.
Okay. Okay. I read the instruction and I'm ready for discussion.
You please tell me about the history which you're going to take, the information gathering.
She is 24 years old, prime gravida, Sudanese girl. Sudanese woman. She is 12 weeks pregnant, and she had circumcision or female genital mutilation. Okay. I will.
History, please.
I will manage this case by taking relevant history, doing for her examination, and I will discuss with her the management plan. Okay, I will introduce myself and my role to the patient, and I will take her permission for taking history, and I will start to take history. I will ask her first about the history of the recent illness, about when that cut exactly happened. And if it happened recently, less than 1 month, I must inform police. Then I will ask her about any complication from the cutting, if she has any urinary symptom, any sexual any intercourse symptom, dyspareunia, or if she has recurrent infection in the vagina. Then I will ask her if she has any psychological feedback about the accident, and if she has any trauma about that, I will contact her with psychological help. Okay. Then I will ask her about her recent pregnancy. And no, before that, I must continue in the discussion about circumcision. I will ask about her opinion if she delivered baby girl, and so if she will do the same thing with her children or not. And then I will take from her the history of her recent pregnancy. I will ask her about if this pregnancy is planned pregnancy, if this is spontaneous or assisted. I will congratulate her. Then I will ask if she is now 12 week, if she doing her booking scan and test, and if she is on folic acid, if she has any medical problem that she follows her GP about it, if she has any surgical from her abdomen or pelvis surgery, and if any family history in concern. And I will ask about her support at home. And I will ask about she is prime gravida, so she has no previous deliveries. I will ask about her last menstrual period, if she using any contraceptive before, and if she is on regular pap smear test, and the last one, and the result of the last one. Then I will ask her if she is from her note she is not a smoker and not drink alcohol. So I will ask her about her blood grouping, and if she has any objection about blood transfusion. And then I will thank her for taking the history. Okay. The examination I will do for her general examination, and I will examine her from down below to see the the type of her FGM, because we have four types of FGM. Type 1, if we just remove the clitoris, and type 2, if they remove the clitoris and minora, and
Yes.
stage 3 هنا type 3 if they do defibrillation by removing the labia minora, labia majora, and stitch the remaining part. And stage 4, the other type of change in the anatomy of the genital area by piercing or tattoo or anything like that. Okay. Then I will counseling the patient about the effect of FGM on her pregnancy and the complications that may happen to her. The complication about for this FGM, it can cause for her small for gestational age baby, and complication during delivery. She may develop tearing or postpartum hemorrhage, and
Okay.
also the recurrent infection during her pregnancy, UTI infection,
Okay.
and yes, and also she may have phobia from
So you've done
vaginal.
the examination and it's type 3, that is infibulation for the
Oh,
patient. So
oh,
can you tell me what investigations you need for the patient?
okay. If it is type 3, I need to do for her virology screening,
Okay.
uh, especially hepatitis B and hepatitis C, and I will do for her sexual screening test for sexual disease, screening for sexual transmitted disease.
Okay.
And I will counseling her that we can do for her defibrillation in the gyne clinic, either in 20 week of pregnancy, or immediately after delivery. And if she delivered
Just
by
wait.
cesarean.
I want you to manage her case.
Okay, I will manage this case antenatally. She must be managed in a consultant-led unit with multidisciplinary team, including psychologist and senior midwife and senior obstetrician. And I will do for her screening for Down syndrome at if she didn't do it yet, and I will do anomaly scan, and I will do for her screening for Gelcostorian cyst at 24 week, and I will do for her serial growth scan from 28 week, as she at risk of IUGR, and also I will give her aspirin from this 12 week, and I will be sure she is taking folic acid, and I will can transfer to tonics. And her delivery will be also, and at 36 week, I will discuss with her the plan and mode of many of delivery. Her delivery will be in consultant-led unit with
When
multidisciplinary.
would you plan the defibrillation, please?
The infibulation I can make for her at 20 weeks of gestation in the gyne clinic by local anesthesia, or after if she delivered by cesarean section, we can do for her after cesarean section or during labor, and we don't. I will tell her it is not allowed to do for her re-infibulation again in Ireland. Okay.
Right.
Then I'll, if she didn't do want to do this
Is antenatal defibrillation better? Is it that recommendation in Ireland, or is it the interpartum defibrillation better?
better intrapartum defibrillation to avoid infection during pregnancy.
Okay, all right. Can you please tell me the antenatal adjustments for her for every visit as an FGM?
Okay. Every visit I will do for her CUA, urine analysis, to be
Mm-hmm.
sure no infection, and I will do for her ultrasound for growth scan, but I will start it from 28 weeks, and I will do it every 4 weeks from 28 weeks. Okay.
Mm-hmm.
Then I will do for her oral glucose tolerance test at 24 weeks, as I said. Okay.
What is the indication for the oral glucose tolerance test?
In her case, actually, no indication, no indication really.
So in FGM,
But
it's not needed. Okay, let's do the intrapartum care and the postpartum care, please. The time is ending.
okay, intrapartum, she will deliver it at term, and she will deliver vaginally if no other indication for cesarean section. And there must be continuous monitoring for her and for her baby. And for pain, she can receive epidural or any type of painkiller. It is not issue. And also after delivery, I will do for her assessment for VTE risk assessment, and I will encourage her for breastfeeding, and I will see if she already if she delivered baby girl, I will register it in the red book. Then I will counsel her about the next pregnancy, preconceptional counseling for her next pregnancy.
All right. Thank you very much. Thank you. Very well done. Very well done. Reason being that suddenly, if somebody is sitting and I'll say, oh, this topic has to be spoken. So whatever you have spoken is on your basal level. That is your reflexes. And I'm so proud of you for this. Very well done, my dear. Thank you very much. Everybody, a big round of applause for Nasreen. And the way she has handled the station was her baseline for the preparation of May exam. And I do understand that it's difficult for all of us to have a good recap immediately for the guideline, but overall was very good. We need to be a little more organized. And this is a station that came on day one, May 2026 in Ireland. I have a perfect way of just having an improvement in certain points. Otherwise, it was really nice the way she has taken. I want all of you to start in a way that examiner gets impressed. I'm going to take the information from the patient according to HSE Irish guidelines. You know? So, Nasreen, the starting, if you're going to make this way, I'm sorry I was marking you when you were speaking through the template. I just wanted you to start in a way that it gives a very good impression and a strong impression. All of you, did you guys understand? If I'm doing the station, I will be starting up with a very strong attire that my information gathering is going to be according to HSE Irish guideline, asking about her reason to come for the antenatal clinic, her vaginal bleeding, pain, nausea, vomiting, any dysuria, difficulty that she has been having on passing urine, and low abdominal pain. Ensure that your HOPI is in this diet. I would then inquire about her obstetric history, if she's a primary gravida, regarding her last menstrual period, cycle regularity, and booking tests done about her sickness, nausea, vomiting, and hyperemesis symptoms, if any. My next part would be regarding the inquiry for the female genital mutilation, asking her about the type, if at all she knows about this, it has been recognized, or asking history regarding the cutting. So similarly, would be also evaluating her for the symptoms. Nasreen, this was missing regarding dysuria, dyspareunia, recurrent urinary tract infections, chronic pelvic pain, and if at all she's a multigravida, then previous obstetric history as well. Okay. Then you have to mention about the psychological assessment. By Irish guidelines, it's a recommendation in HOPI. Mental health history doesn't come late. I would also screen in the history. Seema, are you there? Rumi, are you there? Shirin, are you there? Would screen her for the history of anxiety, post-traumatic stress disorder, and the fear of examination. asking about that she's been connected to the support system in Ireland, if she needs interpreter or not. Would also inquire about the safeguarding, which is regarding documenting her age, having about the minor female genital mutilation as per the Irish recommendation, the TUSLA child protection referral, that's mandatory, and any pressure for reinfibulation if she had been there, that's illegal in Ireland. So I would be using these words again and again to show that, I've read the guideline. The medical and the surgical history, going to mention about if at all she has any past medical history, especially the hepatitis, HIV, because of the cutting history, the past surgeries, blood group, and Jehovah's Witness. Beautifully you mentioned, and I gave you a very good heart on that. I would also like to inquire sensitively being very empathetic. I want you to use these words, sensitively being empathetic regarding the sexual and genitourinary history for her dyspareunia, ability to have intercourse, the sexually transmitted infections, the vaginal discharge. Regarding her social history, in terms of country of origin, she is from Sudan, and would also like to evaluate her duration of stay in Ireland and her living situation, partner support, her personal habits like smoking alcohol, any drugs, and her occupation as well. The whole history would be very sensitive, empathetic, and would also ensure that if at all she has some sort of a concern regarding her family support and if she requires any social counseling for this, right? When you have this information gathering in mind, you are almost 80% pass if you are confident in this, right? Then the examiner says that, can you please tell me the examinations? What would you like to do? So I would like to have a general physical examination. It would be in the presence of a chaperone, the BMI, the blood pressure, the pulse, the temperature, the signs of anemia, infection, abdominal examination, soft abdomen if it is, and the uterine size that's corresponding to the 12 weeks of pregnancy. Would like to evaluate the vulva, the type 3 infibulation, if at all it's a narrow introitus, the scarring and difficulty inserting the speculum. Would like to have an assessment regarding the vaginal opening, adequacy, any cyst, any discharge, any infections there. Would like to continue with the speculum examination and bimanual that might not be successful in the type 3, that is infibulation. So coming to the investigation, need to have full blood count, blood group, HIV, hepatitis B, and hepatitis C. I'm happy that you mentioned this, Nasreen, but I wanted these things to be there as well. The midstream urine, if history of recurrent UTIs are there. The STI screening you mentioned, I was very happy on that. Psychological screening refer to the post-traumatic stress disorder risk that has to be evaluated. Now, these findings have to be explained to the patient and would also tell her that how female genital mutilation can affect the pregnancy, labor, vaginal examination, and catheterization. So episiotomy requirements would be discussed, and it has to be a multidisciplinary team. I was very happy when I said, please manage the case. And Nasreen said this would be a consultant-led care with a multidisciplinary team. That was amazing. Ideally, it should be in a specialized FGM clinic if it's available in the setup. Mental health referral is mandatory. Social working and safeguarding is mandatory. TUSLA referral, especially if it's a risk to the female children, as we asked that in the history. Plan for deinfibulation if type 3 FGM or for elective deinfibulation in the second trimester, and it can be done in early labor or at the time of the delivery as well. Now, HSE recommends antenatal deinfibulation. Nasreen, please pay attention for improved urine flow, reduced infections, allow adequate vaginal examination, allow normal labor monitoring. And we explained that procedure involves opening scar tissue and safe and improved obstetric practice. It would definitely be after a written consent. Type 3 FGM, we offer the deinfibulation and can be performed antenatally in the second trimester, in early labor, and at the time of the cesarean section. Antenatal deinfibulation is preferred if the vaginal examination is not possible, introitus is extremely narrow, and urinary issues are present. We tell the patient that it would allow the normal pelvic examination, reduce the obstructed labor risk. Normal fetal monitoring can be done, reduces the pain during intercourse, and helps the menstrual and the urinary flow proper. So please remember that for exam. Referral pathways refer to the specialized FGM clinic, physiotherapy if severe pelvic floor pain, psychological services if trauma present, and public health nurse postpartum has to be connected to the patient. Now, if the examiner says, what what is specific in the antenatal care for the adjustment? She might have difficulty in speculum examination. Please highlight that. She would be screened for the urinary tract infections regularly, and considering the psychological aspect, we would be talking to her. For the labor planning, birth in a consultant-led unit, early IV access, continuous fetal heart rate monitoring, defibrillation during second stage if not done earlier, avoid reinfibulation, and antenatal from 28 weeks. This patient needs to have a complete birth plan. If defibrillation is done antenatally, it can be normal labor. If no defibrillation in the first stage of labor before the active labor. If it's done in labor, avoid the repeated vaginal examination because it can be uncomfortable for the patient, but an aesthetic review has to be early. If defibrillation is required for this patient, it has to be by trained obstetrician as per Irish recommendations or the midwife who's competent for that procedure. Avoid resuturing back to type 3. That's illegal and harmful as per the law in Ireland. Then you have to make a section and tell the examiner that now I would tell about the postnatal care, the wound care if defibrillation has been done, the sexual health counseling, the contraception discussion, mental health review. You have to give the psychological support, sexual counseling, and the contraception advice in that situation. Make sure that you very clearly document all the details in the plan along with the patient counseling and ensure that you are very clear in the end. If you have 30 seconds remaining, please say it to the examiner in the end that to summarize, I would have a sensitive, non-judgmental approach, a very thorough history, including the psychological assessment and safeguarding, examination and classification type of FGM, offering the antenatal defibrillation, refer to the specialist, female genital mutilation services, a mandatory child protection referral if the daughter is at risk, and reinfibulation is illegal. I would document all the counseling details for my patient. If you mention all this, it would be 90% and above scoring station. Generally, it's not that we don't know the station. Nasreen did beautiful, but the only thing is that a little more structure in the head. I always make a mind map. If you'll see after each station, I give you a mapping of the station, which I'm not doing now for you guys, but you do know that after each station, I make a mind map. Reason for that is that when you're starting a station, you should know the contents. Okay, this I have to cover. And what is the next that I have to cover? If you guys remember this, you would not be missing out the score because examiner is also very organized in, giving you the score for that. Am I clear? Thank you so much. Thank you very much, Nasreen, for being here today. And thank you very much for coming up with all the confidence. And I'm so proud of you. I wish and I pray that all these steps together with all the practice that makes you go above 80%, and I'm very sure about because our starting point is very, very strong. Very well done. Thank you so much. Seema, Shireen, Rumi, Jabi, any question, please? All the students out there, any question for preparation? Now we are starting. Shazia, good to see you here, my dearest. Riham, thank you very much. Pamela, good to have you here. What are the questions in your mind? The things about the preparation? I would not be able to answer only one question about the center, that is it happening overseas or not, because I think college even cannot tell now. It has to be closer to the exam date according to the situation that will be informed. So definitely the Ireland exam is there so far. So we don't have any ambiguity in that as it has been conducted in May 2026 as well. Any question, please? So Seema is active participant. All those who are already in the November batch, make sure that you follow and start putting your recordings as per the daily schedule. The feedbacks will be given. Yes, Nasreen, any question?
Yes,
Hassan,
ma'am.
any question? Yes, please.
About the question came yesterday, cystic fibrosis.
Yeah,
I cannot imagine how the
yeah.
because we have no any in any module or any reference for
We
this
have we
topic.
have a talk article, and I have the station sold for Mrcpi Part 3, and I'm already working on that. My slides would be sufficient, and the way I'm going to solve the question, that will be enough for you guys. So that will be given. I have my tips for this. This was unknown, but students, they still managed it because of the maternal medicine template. So we managed it that way. So most of them, they did passing in that. So I'll give you all the salt stations so you don't have to worry about that. We have a talk article in cystic fibrosis, actually.
Okay.
Yeah. Okay. Any other question? Any other question? Did you guys see the exam? Was it doable? Mm-hmm. Was it doable? The topics? Yeah.
First day doable, but the second day is difficult شوية.
Second day, the questions were not difficult. Yes, the topics were a little more shuffled. So, have any time limit to get a seat, ma'am? No, Rumi, there's no time limit. And especially when the exams are getting cancelled. So now there's no time limit, of course. But the ones who have already taken the Oman seats and preferred for the Oman definitely would be a priority because they're appearing again and they have been on the waiting list. So, you all who were in the Oman and couldn't appear definitely would be in the priority. All right. Any other question? Yeah. Any other question, please? Amo, Shirin. Okay. So, how is the morale? Who is going to clear the exam in November 2026? I need efforts. I need energies. And I need you guys to have faith in yourself that whatever it is, we will give our best. And if you ask me, don't consider your exam in November. Consider your exam in September. If you guys would see, Seema, that the exam is in September, you guys will be rest relaxed and your September end in October would be so easy that you would just do the revision and polishing. This is for all those who want to have more than 80% score. Make a schedule with us in a way that we have our exam in September, and I can give you my words that you all would be not only successful, you all would be scoring very, very high scores in the Osce exam. All right. Thank you so much. With all these prayers, with all these blessings in starting in the days of Zilhajj, with all these blessings and beautiful days, may every single moment that you take your steps towards Mrcpi from this day onward, I wish and I pray that may the peace be with you, may the best of health be with you, and may all the energies and the positivity be with you. May your practice make you so confident that you think about success and nothing else. And may your family be fine. May the health be at its best. And inshallah, we are going to do it together. We'll just take 15 seconds of prayer in togetherness, and then we are going to call it a day. 15-second silence. Please pray for the entire batch. Pray for the world. Pray for each other. You never know that whose prayers in which part of the world that will be getting an Ameen. And may all the success be yours. 15 seconds of silence, please. Thank you. Sallallahu Alaihi Wasallam. Ameen. So Ameen for all of you. I just want that ups and downs would be there, guys. There will be time when you will be feeling low. There will be time when the family pressure would be more. There will be time when kids would be like, Mommy, you're always in books. There will be time during the preparation. It's just a month of May. We would have June, July, August, September, October. There will be time when you'll be like tired, exhausted, that, what's this? I'm studying for so long. But just remember one thing. You never get anything without sacrifice. And if somebody is a Mrcpi today, a Mrcod today, just don't see the completion of their exam. Just see one thing, that they have passed through this time somewhere earlier than you. Nobody in the world gets something without effort, remember. And everybody has got their share of sacrifice. Please remember that. If you give your sacrifice 100% and if the blessings are with you, nobody can stop you from success. But unfortunately, there's no shortcut. All right. So let's not find the shortcuts. Let's start with throttle. Let's start with the best of our potential. Hands in hands together. May the Almighty be with us in all this journey. And let's make November 2026 a success. Thank you so much. Best of luck from the entire team of RFA Tutors. I love you guys. Take very good care of yourself and wishing all the best to all of you. The ones who are still asking that they are in the fast track and they want the regular, please join in on addendum and we are going to make it together the best of the success. I don't know where the Osce mock exams would be other than Ireland, but Ireland definitely is there. The next venue, as soon as the college announces, we are going to take the mock exam there as well. Thank you so much. Take very good care. Remember us all in prayers, and let's make November 2026 a blessed journey, a successful journey together. Thank you so much, Seema, Jabin, Ammu. Thank you very much, all of those who are here in the live session and the ones who are listening to the recording. I love you guys. Take very good care. See you guys in the regular session on 6th of June with all the updated stations, with all the new data, with all the changed questions. Thank you very much. Bye-bye, everybody. Thank you so much. Rumi, the batch has started today. All of you, please join in the November because the intro is started and now the regular discussion for each station every day with the feedbacks would be started. All right, Rumita? Yeah? Thank you very much. Take care, guys. Thank you so much. Bye-bye. The recording would be uploaded. Thank you.